If you have noticed your urine looking darker than usual, if you have seen unusual colors in the toilet bowl that concerned you, if your urine has developed a strong odor that was not there before, or if you find yourself urinating more frequently, especially at night, stay with me for the next several minutes because what I am about to share could be the difference between catching kidney problems early and discovering them when permanent damage has already been done. This is not about minor inconveniences. This is not about temporary changes that fix themselves. This is about your kidneys sending you urgent messages through your urine every single day. Messages that most people flush away without a second thought. Messages that doctors often miss because they are looking at blood tests instead of asking the right questions. Let me make you a clear promise right now. By the end of this video, you will know exactly which urine colors indicate your kidneys are struggling. You will understand why certain changes appear in your urine long before standard tests show any problem. And you will have a practical system for monitoring your own kidney health starting today, not next year at your annual physical. Today, I am Dr. James Mitchell. I have spent decades working with patients who came to me with kidney problems at various stages. Some caught the warning signs early and preserved their kidney function for decades. Others ignored the signals their bodies were sending and ended up facing dialysis or worse. The difference between these two groups was rarely genetics. It was rarely bad luck. The difference was awareness. The difference was knowing what to look for and taking action when the signs appeared. One of the most frustrating patterns I see is how often people are told their kidneys are fine, based on a single blood test, while their urine has been showing warning signs for years. Standard kidney blood tests often remain normal until you have already lost significant kidney function. By the time creatinine levels rise on your blood work, you may have lost 40% or more of your kidney capacity. But your urine starts changing much earlier. Your urine tells the truth when blood tests are still saying everything looks fine. So now I want to ask you directly, have you noticed any changes in your urine color over the past several months? Darker shades, unusual tints, cloudy appearance, foamy texture? Write your answer in the comment section below because this awareness could save your kidneys. And once kidney function is lost, we cannot simply get it back. Let me tell you about a patient named George. George was 64 years old and considered himself healthy. He exercised occasionally. He took his blood pressure medication faithfully. His annual blood work always came back normal. His doctor told him his kidneys were fine year after year. But George had noticed something he never mentioned to anyone. For the past 2 years, his urine had been consistently darker than it used to be. Not dramatically dark, just noticeably different from the pale yellow he remembered from years before. He assumed he was not drinking enough water. He tried to drink more for a few days here and there, but the color never really changed back to what it was. George also noticed his urine seemed foamier than before. When he urinated, there were bubbles that lingered on the surface. He figured it was normal. He figured it was just how toilets worked. He never considered it might be a message from his kidneys. When George finally came to see me, it was because his legs had started swelling. That was the symptom that finally got his attention. When we tested his kidney function, we found he had already lost nearly half of his kidney capacity. His kidneys had been deteriorating silently for years, and his urine had been trying to warn him the entire time. Here is the question I want you to hold in your mind. What had George missed in his toilet bowl for those 2 years? And how many people are missing the exact same warning signs right now? The answer could change how you think about every trip to the bathroom. To understand why urine color matters so much, you need to understand what urine actually is. Urine is not simply wastewater. Urine is a detailed report on everything happening inside your body. Your kidneys filter approximately 180 liters of blood every single day. They decide what to keep and what to discard. They regulate your fluid balance. They control minerals and electrolytes. They remove toxins. They help control blood pressure. They even produce hormones. When your kidneys are functioning well, they produce urine that reflects healthy filtration. When your kidneys are struggling, they produce urine that shows the strain. The color, the clarity, the odor, and the texture of your urine all provide information. And this information appears long before blood tests become abnormal, because urine comes directly from the kidneys, while blood tests measure what has accumulated after the kidneys have failed to filter properly. Your urine is essentially a real-time report card on your kidney function. And most people throw away this report card multiple times every day without ever reading it. Now let me walk you through exactly what different urine colors mean and which ones should concern you immediately. The first color to understand is pale straw yellow. This is the ideal. This is what healthy, well-hydrated kidneys produce. If your urine looks like light lemonade or pale straw, your hydration is good, and your kidneys are likely filtering efficiently. This is your baseline. This is what you want to see most of the time. The second color is transparent or completely clear. Many people think clear urine is the goal. They believe the clearer the better. This is actually incorrect. If your urine is consistently clear like water, you may be overhydrating. While this is usually not dangerous in itself, it can indicate a problem if you are not drinking excessive amounts of fluid. Kidneys that cannot concentrate urine may produce consistently clear urine even when you are not drinking much. This can indicate early kidney dysfunction. It can also indicate diabetes. If your urine is always clear and you are urinating very frequently, you should have this evaluated. The third color is dark yellow or amber. This is where many people first notice something different. Dark yellow urine usually indicates dehydration. Your kidneys are concentrating the urine to preserve water. Occasional dark urine first thing in the morning is normal because you have not had fluids overnight. But if your urine is consistently dark amber throughout the day, even when you believe you are drinking enough fluids, this can indicate your kidneys are under stress. Chronic dehydration damages kidneys over time. It forces them to work harder to concentrate waste products. Many seniors are chronically mildly dehydrated without realizing it because the thirst sensation diminishes with age. Persistent dark urine is a warning sign that should not be ignored. The fourth color is orange. Orange urine can have several causes. Dehydration can produce orange-tinted urine. Certain medications can turn urine orange, especially some antibiotics and anti-inflammatory drugs. Excessive vitamin B supplements can create orange urine. But orange urine can also indicate bile duct problems or liver issues which directly affect kidney function. If your urine is orange and you cannot identify an obvious cause like medication or supplements, you should have your liver and kidney function evaluated promptly. The fifth color is the one that brings the most urgent concern. Brown or cola-colored urine. If your urine looks like cola or dark tea, this is a serious warning sign that demands immediate attention. Brown urine can indicate severe dehydration, but it often indicates something more dangerous. It can mean muscle breakdown where a protein called myoglobin is flooding your bloodstream and damaging your kidneys in real time. It can indicate serious liver disease. It can indicate acute kidney injury. Brown or cola-colored urine is never normal. It should never be dismissed or waited out. This color demands evaluation within hours, not days. The sixth color is pink or red. Any red tint in urine indicates blood. Sometimes the blood is visible as clear red. Sometimes it creates a pink or rusty appearance. Blood in urine is always significant. It can indicate kidney stones, which while painful are usually manageable. It can indicate urinary tract infections. But it can also indicate kidney disease, kidney tumors, bladder problems, or prostate issues in men. Some medications and foods like beets can create red-colored urine temporarily. But true blood in urine has a distinct appearance. If you see red or pink in your toilet bowl, and have not eaten beets or taken medication that explains it, you need evaluation immediately. The seventh color is blue or green. This sounds unusual, but it happens more often than people realize. Blue or green urine is almost always caused by medications or dyes. Certain pain medications, antidepressants, and anesthetics can create these colors. Some medical tests use dyes that turn urine blue or green temporarily. This is usually harmless and resolves when the medication or dye clears your system. However, persistent blue or green urine without explanation can indicate rare bacterial infections and should be evaluated. Now I need to share something beyond color that is equally important. The appearance and texture of your urine provides critical information that many people overlook. Cloudy urine is a warning sign that should never be ignored. Healthy urine is clear. You should be able to see through it. Cloudy or murky urine often indicates infection. It can indicate kidney stones. It can indicate phosphate crystals, which suggest metabolic problems. It can indicate protein spilling into your urine, which is a direct sign of kidney damage. If your urine is consistently cloudy, your kidneys are telling you something is wrong. Foamy urine is perhaps the most commonly missed warning sign of kidney disease. Occasional bubbles when urine hits the water are normal, but foam that looks like the head on a beer and persists for more than a few seconds indicates protein in your urine. Your kidneys are supposed to keep protein in your blood. When protein appears in urine, it means the kidney filters are damaged. This is called proteinuria, and it is one of the earliest detectable signs of kidney disease. Many people notice foamy urine for years and never mention it to a doctor because they assume it is normal. It is not normal. Persistent foamy urine is a red flag that demands investigation. Let me tell you about another patient named Margaret. Margaret was 71 years old and came to me because she had read something about foamy urine online. She had noticed for at least 3 years that her urine always seemed bubbly and foamy. Her blood work had always been normal. No one had ever mentioned her kidneys. When we tested Margaret specifically for protein in her urine, we found significant proteinuria. Further investigation revealed early diabetic kidney disease, even though Margaret had never been diagnosed with diabetes. Her blood sugar was in the pre-diabetic range. It had been quietly damaging her kidneys for years, and the only outward sign was foam in the toilet that she almost did not mention. Margaret caught her kidney disease early enough to slow its progression dramatically. If she had waited until her blood work became abnormal, she would have lost years of kidney function that she can now preserve. This brings me to a critical point about kidney disease that most people do not understand. Kidney disease is called a silent killer because it produces almost no symptoms until significant damage has occurred. By the time you feel sick from kidney disease, you may have already lost the majority of your kidney function. There is no pain sensor in your kidneys. They do not ache when they are struggling. They simply work less and less efficiently while you feel nothing. But your urine tells the story. Your urine shows the damage accumulating. Your urine offers warning signs months or years before you feel any symptom. This is why paying attention to what you see in the toilet bowl may be one of the most important health habits you can develop. Now let me share what actually damages kidneys and causes these urine changes. Understanding the causes helps you protect yourself. The first major kidney destroyer is chronic high blood pressure. Your kidneys are filled with tiny blood vessels that filter your blood. High blood pressure damages these vessels over time. The damage is silent. The damage is cumulative. Many people with high blood pressure for years develop kidney disease without ever knowing their blood pressure was the cause. Controlling blood pressure is one of the single most important things you can do to protect your kidneys. The second major kidney destroyer is blood sugar toxicity. Diabetes is the leading cause of kidney failure. But here is what most people do not realize. You do not need full diabetes to damage your kidneys. Prediabetes and even blood sugar levels that doctors call borderline can damage kidney tissue over time. Every spike in blood sugar creates inflammation in the tiny vessels of your kidneys. Years of repeated spikes cause progressive damage. Many people who develop kidney disease from blood sugar never knew their sugar was high enough to be a problem. The third major kidney destroyer is chronic dehydration. Your kidneys need adequate water to function properly. When you are chronically dehydrated, your kidneys must work harder to concentrate waste products. This strain damages kidney tissue over time. Many seniors are chronically mildly dehydrated because their thirst sensation has diminished. They do not feel thirsty even when their bodies need water. Dark urine is the warning sign of this ongoing strain. The fourth major kidney destroyer is overuse of certain medications. Pain medications called NSAIDs, including ibuprofen and naproxen, are particularly damaging to kidneys when used regularly over time. Many seniors take these medications daily for arthritis or chronic pain without realizing the cumulative kidney damage they may be causing. Certain acid-blocking medications can also affect kidney function. Even some antibiotics can cause kidney injury. This does not mean you should stop necessary medications. It means you should be aware of potential kidney effects and monitor accordingly. The fifth major kidney destroyer is excess sodium. High sodium intake forces your kidneys to work harder and raises blood pressure, which further damages kidney tissue. Processed foods are loaded with hidden sodium. Many seniors who believe they eat a healthy diet are consuming far more sodium than they realize because it hides in bread, canned foods, condiments, and restaurant meals. Now let me share what you can actually do to protect your kidneys starting today. The first step is to start monitoring your urine consciously. Every time you urinate, take a moment to look before you flush. Notice the color. Notice the clarity. Notice whether there is foam. This takes 2 seconds and provides valuable information. If you see persistent changes that concern you, document them and bring them to your doctor. The second step is to hydrate adequately but not excessively. Most seniors should aim for 6 to 8 glasses of water daily, adjusted for activity level and climate. Your goal is pale straw-colored urine, not clear, not dark amber. Pale straw. If your urine is consistently darker, drink more water. If it remains dark despite adequate hydration, something else may be affecting your kidneys. The third step is to control blood pressure aggressively. If you have high blood pressure, take your medication faithfully. Monitor your pressure at home. Work with your doctor to keep your numbers in a healthy range. Your kidneys will thank you for every point you reduce your blood pressure. The fourth step is to stabilize blood sugar. Even if you are not diabetic, your blood sugar matters. Avoid liquid sugars completely. Pair carbohydrates with protein and fat. Limit refined carbohydrates. Get your blood sugar tested regularly, not just once per year. Ask specifically for a hemoglobin A1C test, which shows your average blood sugar over 3 months. This test reveals problems that single glucose readings miss. The fifth step is to review your medications with your doctor, specifically asking about kidney effects. If you take NSAIDs regularly, discuss alternatives. If you take acid blockers long-term, ask whether they are still necessary. If you take multiple medications, ask whether any of them may be affecting your kidneys. Knowledge is protection. The sixth step is to reduce sodium intake. This means reading labels. This means cooking more at home. This means being suspicious of processed foods. Aim for less than 2,300 milligrams of sodium daily, and ideally closer to 1,500 milligrams if you have blood pressure issues or known kidney concerns. The seventh step is to request specific kidney testing beyond standard blood work. Ask your doctor for a urine albumin test, which detects protein in your urine at levels too low to cause visible foam. This test can find kidney damage years before blood tests become abnormal. Early detection allows early intervention, which preserves kidney function. Let me tell you one more story. A man named Robert came to me at 69 years old specifically because he had watched a video about urine changes. He had noticed his urine had become persistently foamy over the past year. He had also noticed it seemed darker than usual and had a stronger odor. Robert had no symptoms. He felt fine. His energy was good. His last blood work had been normal. But he was concerned enough to ask questions. When we tested Robert, we found early-stage kidney disease that had not yet shown up on standard blood tests. His blood pressure had been running slightly high for years without adequate treatment. His blood sugar was in the pre-diabetic range. His kidneys were already showing strain from these factors. Because Robert caught this early, we were able to intervene aggressively. We optimized his blood pressure control. We addressed his blood sugar with dietary changes. We adjusted his fluid intake. We monitored his kidney function closely. 2 years later, Robert's kidney function has remained stable. He has not progressed. He avoided the decline that would have occurred if he had waited until symptoms appeared or blood tests became abnormal. His urine gave him the warning. He listened. And listening changed his future. This is what I want you to understand. Your kidneys are not expendable organs. You cannot buy new kidneys at the pharmacy. Once kidney function is lost, it rarely returns. Dialysis keeps people alive, but it dramatically changes quality of life. Kidney transplants are possible, but they require donors and come with lifelong complications. Prevention and early detection are everything when it comes to kidney health. And the simplest, earliest form of detection is available to you every time you use the bathroom. Your urine is talking to you. The question is whether you are willing to listen. For the next 2 weeks, I want you to practice conscious urine monitoring. Look at every urine before flushing. Note the color. Note whether foam appears and how long it lasts. Note any changes from your normal. If you see persistent foam or consistently dark urine or any unusual colors that do not resolve within a day or two, contact your doctor. This simple practice costs nothing and takes seconds. But the information it provides could save your kidneys. It could save your independence. It could save your life. Anyone who tells you that urine color does not matter is not paying attention to the research. Anyone who tells you that blood tests catch all kidney problems early is not being accurate. Your urine provides information that blood tests cannot. And that information is available to you right now. I have spent my career trying to help people understand what their bodies are telling them. Your kidneys speak through your urine every single day. They send messages about hydration, about filtration, about stress and damage. These messages are honest. These messages are early. And these messages deserve your attention. The warning signs are real. The opportunity to protect your kidneys is real. And the time to start paying attention is not at your next physical exam. The time is now.